What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for all those viruses that can make us sick. It is time now for the Wednesday edition of the Virus Update from Out in the Wild for Wednesday, December 10th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there. The viruses are heavily in circulation at this point in time, and you need to be informed of what's going on. That's what I do here on my channel each and every day. Want to stay informed? Just subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below, and ways to support the channel are listed down below. Alrighty, we are out in the wild today as I don't have time to do a data-filled update from home. And plus, I think after yesterday's very busy news day, we need something a little bit lighter, although we do have some bad news to report. And I do have a chart to share with you today as well. Yeah, so we'll take a look at that in a moment. Starting off with this, though, let's just get the news out of the way, and then we'll do some other random things. First off, Utah. The Salt Lake County Health Department confirmed a case of measles in another facility. Yet again, the infected person is unvaccinated, and the source of the infection is unknown. They were reportedly infectious while attending a facility, which is within Bingham High School. Yikes. So, yes, they attended a child care facility in Bingham High School between December 1st and December 5th. Yikes. That's not good, and it's already responsible for one case. Will it lead to more cases like we've been seeing in other parts of the United States? It very well could. We're continuing to see more schools deal with outbreaks. I'm going to skip over the top school story that I have, because let's give you an update on something we talked about yesterday. Remember yesterday we talked about a school in Iowa was closing because they were dealing with illness. I think it was, 30% of that school was out sick. Well, guess what? Iowa now reports 3 schools, yes, 1, 2, 3 schools across the state have at least 10% of students out with illness as flu season gets underway. This is evolving pretty quickly. We had 1 reported Monday evening, and now already it's up to 3. Is this going to continue to increase? Remember last year, Iowa was one of the early ones, or at least I think it was, with I think they had a few now, but then they had another round in late January into February. Iowa was one of the states that got hit hard. We heard a lot of news stories. And often, I've said this before, oftentimes in rural areas, not big markets, like I live in the Philadelphia area, we don't hear a lot about this. But in rural areas where you have smaller communities, hey, something like that, that's a big news story. You don't have a lot of news stories in those areas. So a school closing for illness, yeah, that's going to be one of their headlines. And yeah, we're going to be hearing a lot about this from rural areas, and we do have another one now. This being in Texas, Wells ISD. I believe that stands for Independent School District. Wells Independent School District announced it will not be holding class for 2 days due to a high number of students out sick. The school will be closed Wednesday and Thursday. Okay, so they're going to go back Friday. Why not just give them Friday off too, and then start all over again next Monday, and maybe in between buy some air purifiers to clean the air in the classroom? I know it's expensive, but yeah, here's what they say. We feel it is in everyone's best interest to take a 48-hour deep clean. Don't get me started on that. 48-hour deep clean of our district, the school said. This will allow for our staff to sanitize classrooms, common areas, and high-touch services thoroughly. Okay. We got to have a discussion about that. So they want to do a deep clean sanitation. We saw this with with the majority of the news stories during last year's virus season, 2024 to 2025 virus season. Here's the problem with that. Sanitizing and cleaning schools. Fantastic. I'm glad you're doing that. Look at my mouth. My mouth is open. You may see stuff come out of my... You can't see particles coming out of my mouth. When I'm speaking, particles are coming out of my mouth. When someone is sick, germs are coming out of the mouth. The majority of these viruses are airborne. A virus that's airborne, if something comes out of my mouth, it's going into the air. And you know how a classroom is. Say there's 30 kids in a classroom, right? Say my car seat, right? Let's pretend this is a school desk. Then there's another desk right here. Okay, when my air's coming out, the person next to me is breathing as well. They're breathing in that dirty air. So I get it, sanitizing, yes, viruses can also spread on surfaces. But making sure the school gets a deep clean, that's not going to prevent what's coming, the air that people are breathing in and out. That's not going to clean the air. We need air purification systems that clean the air in these schools. So therefore, yeah, maybe this is going to help slow the spread because they're off a couple of days. But if someone else is just starting to become infectious, say Friday when they go back, guess what? More people could end up getting sick. So this virus outbreak they're dealing with, it could continue to spread because these viruses are airborne. Round and round we go. Where we stop, nobody knows. Okay, over to New Hampshire is where we head to next. New Hampshire reports that they have recorded its first flu-related death of the season, even as influenza activity is now low across the state. So New Hampshire is reporting their first flu-related death of the season. And I'm sure there have been more states that have had their first death. We probably just haven't heard about it or some places that maybe are already on their second or whatever. I don't think all the flu death stories get to the news. The ones that do, though, and this is important, is the pediatric deaths. I don't know. Have we seen any of them yet? North Carolina seems to be ringing a bell, but unfortunately, they will probably be coming in the near future. Dennis, the COVID info guy, New Zealand. COVID weekly update for December 7th, 2025. This is December 1st through December 7th. And COVID cases. This is good. 162. That's down by 11.9%. One case is too many. Now, a little bad news. Reported deaths, they added another 9. That's up by 50%. Total deaths, 5,497. You may remember in the early days of the pandemic, New Zealand did such a good job. They kept the deaths so low. And New Zealand, just like everywhere else in the world, is having COVID deaths. Hospitalizations, now that data is from November 18th to the 24th. Hospitalizations there, 25. That's up by 4.1% at this time. All right, Philly had 744 EMS incidents on Tuesday, which now does bring me to the ambulance meter and the coughing meter, because this is out in the wild, and both numbers are going up. It's getting pretty serious now. Ambulance meter, 6.5. You know, if I didn't have an interruption a few minutes ago when this video started, if I would have started 30 seconds earlier, you would have heard an ambulance behind me. St. Mary's Medical Center. We're up here in Bucks County, Pennsylvania today. St. Mary's Medical Center is right behind me. I'm sure it's very busy. Would have seen, I had a chance, I could have seen Penn Princeton Medical Center. Remember that one that we've been talking about being on Divert multiple times on these videos lately? Well, it would have worked out that I have two catering orders from Wegmans. They tried to give me a third one. I was trying to figure if it would work out or not, and then someone else had already took it. But a Wegmans in Princeton, New Jersey, going right near that Penn Princeton Medical Center. So we almost would have had a field trip to see what it looks like at that hospital. We didn't, but yeah, that hospital has been very busy, as have been many hospitals. The hospitals are definitely starting to pick up now. All right, coughing meter. It's going up. I'm hearing even more coughing now. And, you know, we always do scale of 1 to 10. Will we ever take that over a 10? It's possible. Maybe that we do go higher than a 10 or just say 10 plus at some point. But for today, the coughing meter, and again, this is just the number of people that I see sick, the coughing I'm hearing when I'm out in the wild. What number you get could be completely different. Could be lower, could be higher. The coughing meter index today is an 8. Yep, more people are sick now. It's 8. It's really starting to get up there, and I suspect when we do another Out in the Wild, when that's going to be, it's going to be Saturday, is it going to be next week? I don't know. If it's Saturday, we'll just probably keep it the same, unless we hear a lot more coughing. Next week, I suspect it's probably going to go even higher. Yeah, coughing meter is now an 8, meaning it's getting risky out in the wild, and I can tell you this much, I'm seeing on the delivery apps a lot more requests for picking up grocery deliveries now. So there are some people that still prefer, at least at this time of year, prefer not to go to the grocery store, or maybe they just don't have time, or maybe it is they are sick. And yeah, the overall number of delivery requests for everything. I mean, I'm in an area right now that at one time was not very busy for delivery, and I had more requests today than I would normally get in this area. We'll see what happens at lunchtime in between that catering orders, because there's a gap in between and then afterwards. We'll see. There's a not so busy area now busy because of the time of year. There's also more places up here now than there used to be. I don't know, but definitely appears to be more people sick. And guess what? There's somewhere else that is kind of agreeing to that. New York City. Now, I printed out this chart for you. Flu is surging in New York City with cases increasing earlier than usual. Flu laboratory reported cases by season. And take a look at this bright purple line right here. Take a look at that. You can see 2025, 2026. And then you see 2024, 2025, 2023, 2024 over there. Here's 2026 right here. Look at that. It is clearly going up earlier than usual and faster than usual. Look at my pen here. It is almost going straight upward. Christmas is yet to come. Hanukkah is yet to come. Kwanzaa is yet to come. Three Kings is yet to come. Orthodox Christmas is yet. All these different New Year's still yet to come. And mind you, this data is lagged by a few weeks. So, I mean, I shouldn't say a few weeks. This data can potentially be lagged. So we're just now starting to see the impact that we had from Thanksgiving. We're seeing what's happening over in the UK. That is starting to become reality here right now in the United States. Again, that chart, I got to show it to you again. I mean, look at that. New York City quickly going straight up, and we're going to start seeing this in other major cities all across the United States. Yeah, I'll tell you what, it's been much busier for news stories lately. Have you been following my X account, Blue Sky, to a certain degree, my Facebook page, Data Report? I think two of my accounts are Data Reports. One is still COVID Data Report. I think that's X, that's still COVID Data. It's in the description down below. I'm also on Counter Social too. Why not? The more exposure, the more people that can see these news stories, the better. But I'll tell you what, we've been having a tough time keeping up with the tracking threads. One, it's a busy time of the year for me. But two, just the number of news stories. If you're seeing something that I'm not saying, which today is highly likely because right now it is, 10-something in the morning. A lot of news can pop up between now and later in the day, the time that I post this in the afternoon. If you're seeing something that I'm not talking about in terms of the viruses, like specifically United States, maybe the UK, not one of those random, oh, did you hear about a new virus? We can't fit that in right now. There's just so much stuff going on. Yesterday was a 23-minute video, for goodness sake. And I got a feeling with what we missed today, what pops up tomorrow, what we may have missed yesterday, tomorrow's going to be one of those 20-plus minute videos as well. I mean, it's that time of year. People are getting sick. You need to take precautions. You need to keep yourself safe. Christmas. Can you believe it? Christmas is just, I think we're at the 2-week mark. Tomorrow's Thursday. Christmas is on a Thursday this year. Not next Thursday, but the following Thursday is Christmas. And I made a post yesterday, and I stand by this post. I know many people will go to their celebrations, Christmas Eve and Christmas Day, sick, but millions of people this year are going to be spending Christmas sick, whether it's COVID, flu A, flu B, pneumonia, you name the virus, RSV, norovirus we know is rapidly spreading across the United States. Millions of people are going to be sick, and I'm sure Zoom is going to be in for a little bit of a surprise. Oh, why do we have so many people doing Zoom on Christmas? Because people are sick. I am sure there are going to be people scrambling as we get close to Christmas. Oh, I got a really bad case of COVID or flu, which this new mutation of flu said to be more severe. There's going to be people scrambling to change their flight plans for, yeah, I'm telling you, it's going to be that bad on Christmas. Millions of people are going to be spending Christmas sick. Alrighty, folks, that's all I have time for today. I could keep rambling on here about what's happening and what's about to happen, but we don't have time for that today. We will have a data-filled update from home tomorrow. Expect it to be a very busy virus update. I'll do my best to update the tracking threads this evening. I'll also try and catch up on all these comments. Sorry if I haven't gotten back to you. It's been really busy It's a lot to try and keep up with everything right now. If you enjoyed today's update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course leave your comments down below. And real quickly, before we go, this is out in the wild. So out in the wild, in the morning time means we can have a sip of coffee. Let's pause and have a sip of coffee. Maybe you're working from home today or doing whatever. Maybe it's coffee time. Maybe you're on your lunch break and you're spending your lunch break watching Data Report. Hey, thank you so much. Let's have a sip of coffee, shall we? Ah, that feels good. Alrighty, folks. I will see you all again tomorrow. Until I see you again tomorrow, stay safe, everyone. Take care. Thanks for watching.